I grew up in just outside Stockholm, Sweden, and that's where I went to medical school, received my basic medical training. Then I came to Wisconsin right away and did my specialty training at University of Wisconsin in Madison. And I have lived and worked in Wisconsin ever since, and that's over 25 years now, specializing in women's health. I have had a long career with the University of Wisconsin as a clinical associate professor, and then I got the opportunity to work in a more personalized practice, and I grabbed it. I often get that question or comment from people in the waiting room that are coming with a patient, or family and friends even. Think, well, I'm not having any more babies, or I'm not planning to have any at all, and so I don't need to see an OB-GYN doctor. But there's a lot of women's health issues that we are specifically trained to help women with. So I really encourage everybody to get their own OBGYN, and you can see an OBGYN without a referral and still keep your primary care provider, and the two of us can work very closely together to address any kind of health needs that you have. Well, a very common issue is abnormal uterine bleeding, and that can mean anything from heavy to frequent to prolonged, extra painful bleeding, prolapse of pelvic organs for various reasons that I'm going to get into in a little bit. It often goes with loss of bladder control, and then also as we mature as women's sexuality. Because of all of the above I just listed, bleeding, the prolapsing organs, and loss of urine or bladder control, that really is not any kind of excitement for sexuality. It's a downer. So with regards to abnormal bleeding, like I said, it can be all kinds of what is abnormal. If you have bleeding more often than every 3 weeks, if it lasts for more than 8 to 10 days at a time, that's all considered abnormal. And then there are women that have the opposite problem. They only have a period every 3 months. And that constitutes its own issues that is important to talk about in a more personalized setting and go over the particular situation. Bleeding can be due to hormonal fluctuations, perimenopausal women's twilight zone, I call that. Polyps, like you can get polyps in your digestive tract, in your nose, you can get them in your uterus too. And they're often rogue, meaning they do their own thing with regards to bleeding. They don't listen to the hormonal signals, even if they are nice and shaped, doing what they're supposed to. Fibroids, which are another type of non-cancerous and not precancerous growth on the uterus, can also make bleeding a lot heavier and lasting longer. And so those are the most common reasons why women have irregular bleeding. And the most important thing is come in so we can figure out what's going on. And sometimes that's all a woman wants to hear, that hey, there's nothing dangerous going on, that this is not serious. And she can choose to, okay, it's not great, but I can put up with this, I'd rather not do anything, and that's acceptable. Then there's treatment that can, range from medications to office procedures to surgical intervention that is, more elaborate. So just coming in to see myself or one of my colleagues does not mean you are signing on to have, very advanced or elaborate surgeries or anything like that. It's more of a fact-finding mission, find out what your options are, if anything can be done. And usually they can. Doing nothing is always an option. And I think a lot of people are afraid that the doctor's going to try to push, painful surgery on them and stuff. And I can't emphasize enough how much time I spend talking women out of surgery, that they say, oh, just take it out. And it's like, no, we're not going to start with that. That may be the end conclusion, but that's not the first thing you do in the most cases. Another issue that affects women a lot is prolapse, pelvic organ prolapse, or POP, like we call it. That means that with time, the pelvic floor, which is, if you think of a hammock, that a lot of your internal organs are resting on. And that doesn't get stronger. Like most of us, we don't get stronger when we get into our senior years. So that supportive muscle floor gets weaker and starts sagging. And it's this form of a hernia, basically, that there's a weakness and things can bulge through. And the risk factors for that are, like I mentioned, age. Being a woman, unfortunately, is a risk factor. Men don't have much of this problem, but because we have often pregnancies in our history, giving birth, vaginal deliveries, large babies is more of a risk factor. If you're a smoker, the strength of tissue anywhere is weakened. If you are on long-term steroids like cortisone or prednisone because you have certain diseases that require that, that unfortunately weakens any tissue in your body as well. And also your weight, because that is also loaded on top of this pelvic floor. And the more bricks you put in that, it's going to start dropping more and more. And that's the one thing that we have some control over. Prolapse often goes with loss of bladder control. Like you laugh, sneeze, or cough, or try to dance, do a little jig, and there comes some urine pop. And it's not particularly pleasant. Anything from the time and tried Kegel exercises that most people have heard of, but maybe many don't do, most of us don't do, and are a little vague about how to do, to pelvic floor physical therapy, sometimes biofeedback. There are specialized mechanical devices, including there's some over-the-counter specific tampon types that can be used for incontinence, to surgical intervention. So there's a whole lot of things that can be done with that as well. Anything from very low intervention, self workouts at home of your pelvic floor, to more advanced, again, depending on the situation and what the patient desires. So all of these things combined, obviously, if you have bleeding here and there and unpredictable and heavy, you might have some prolapse, you have a loss of urine when you don't want it, and then your hormone starts going haywire, and you have hot flashes, and you don't sleep from night sweats, you experience vaginal dryness because you have low estrogen levels as you enter the area after periods are done, maybe. That has often a very negative effect on women's sexuality and desire for being intimate with their partners. And that can be devastating for a relationship. And it's not talked about a lot. It's not coffee talk for most people, but for us it is. So there is pretty much nothing you can come into our office and talk about that we haven't already heard. So we're the perfect private, confidential place to have those discussions. And sometimes it's as simple as treating dryness with an estrogen type vaginal cream that doesn't really get into your body, doesn't carry the same risks that estrogen by patches or pills do. Not the same benefits either, unfortunately, but certainly addresses that area specifically. And that can be a lifesaver. And also addressing all these other issues that may happen with increasing age can make women much more interested in being intimate and having a satisfying sex life up into very senior years. My advice to all women is that if you have an issue, whether it is bleeding too frequently, not frequent enough, prolapsing pelvic organs, incontinence, sexuality, any other issues that is affecting your quality of life, it's time to call your OBGYN and come in and see us, and we'll go through your history and talk about what's going on. And I can't guarantee that we can 100% fix everything, but we'll do our very, very best to make things better and follow up on everything that's available to get you to a better place. In addition to our own little specialty group, there are several other specialties within Upland Hills Health that we may refer you to or get the assistance with to help control your symptoms or problem. And that includes physical therapy that I previously mentioned, and also dietary. There's a sleep clinic. We also have access to a whole slew of other specialists as needed. So we can be your gateway to help in many areas. We are a team of 3 specialty trained OBGYNs, Dr. Barbara Hostetler, who was the pioneer here of the department, myself, and Dr. Tim Rakel, who joined us about a year ago. We were all actually former colleagues at University of Wisconsin at one point in time. So we cover everything, the whole spectrum of women's health, and there is not a whole lot that we cannot do here in our offices or in our operating room or in our practice in general, but you can get top-notch care here.